All right. Welcome, everybody, to Willow Legal Group's Coffee Chat. We are really excited to have Jessica Parker here with us today. Jessica is a speech language pathologist. Whew, try to say that 5 times fast.
It's a mouthful.
So she has been practicing for over 20 years. Jessica has worked in a variety of settings, including hospitals, rehabilitation facilities, nursing homes, outpatient clinics, and most recently has started her own business and has a private practice helping adults with speech, pathologies and speaking. So the common passion in helping adults experience a change in their communication or cognitive skills due to brain-related a diagnosis, such as stroke or brain injury, dementia, Parkinson's disease. And Jessica is really skilled in helping those adults navigate life after such a major change. She opened her own practice, Adult Speech Therapy Services, about 8 years ago, so she can provide quality, individualized speech therapy services to adults in our community. Jessica is really excited to have recently launched a new product. It's a Caregiver Coaching Video Series, which is designed to educate and empower family members, friends, and medical professionals who work closely with this population to support the communication skills. So welcome, Jessica. We're excited to have you.
Thank you so much for having me. It's great to be here.
So I'm sure I left a couple things out in there. Anything I left out that you want to highlight in the community you work with, the people you work with?
Right. So lots of folks are sort of surprised when they hear that I work with adults. So when they hear speech therapists, they think, oh, you work with kids in the schools, right? Mm-hmm. So part of what I like to do is educate people about the fact that adults need speech therapy too. So typically the clients that I work with are adults who have experienced some sort of change in their brain due to a medical diagnosis. So like you said before, stroke, brain injury, or sometimes degenerative diseases like Parkinson's or dementia, something like that. So it really is important, I think, for the community to understand that speech therapy isn't just for kids, it's for adults too.
Yeah. So tell us a little bit about, how does this work, right? Like what's the magic behind it, or what's the brain chemistry pieces behind all of it?
Yeah, that's actually a great question. So as a speech therapist, our job is complex. It's not just to be a coach, right? It's actually to understand the brain science so that we can support brain healing over time. And that's another thing that I feel like a lot of people are surprised to learn about, is that the brain is actually able to heal, to make new connections, to change and grow. It's a process called neuroplasticity. So as a speech therapist, my job is basically to understand the principles of neuroplasticity, how the brain can heal. And we take advantage of what we know about that process to help speed up the healing process. So for example, one thing we know about neuroplasticity is that the brain heals and makes new connections in response to practice. And not just practice, but frequent practice, and practice that is meaningful and important to the person who is working. So when I was first training decades ago, we used a lot of workbooks. We'd pull out a workbook and sort of use the same workbook with every client. But something that's changed over the years as we've had a better understanding of how the brain works is that we no longer use cookie cutter therapy with every single patient. We find out what each client is interested in, what is meaningful and important to them, and we work that into our treatment. Because it turns out your brain responds better when you're learning about or listening to or reading about things that are interesting to you. I mean, it makes sense. It's common sense, but it really helps us to make therapy more interesting and fun for each client, but also makes it more salient, more powerful. So that's a big part of my job, is to teach people how to exercise their brain to speed up the healing process.
Wow. That's really fascinating. Like, didn't even think about all of that.
Yes. I kind of nerd out on the brain science. I get really excited when we talk about things like this because it's so important for people to understand that even if they've had some kind of medical change and there's something has happened to their brain and they're not able to function as well as they were before, there is hope. There is a way for their brain to heal and recover, especially if you're working with the right professionals who understand that process.
Yeah. So tell us some more about the video series that you're just launched, and who's it good for? How does it get used? All the
So another important piece of my treatment time with my clients is not only to train the client themselves about how to exercise their brain, but also to educate their family members and caregivers, their support system. As you can imagine, folks tend to do better when they have support at home. It makes sense. They're learning a lot in therapy. There's a lot of take-home information, if you will, home practice that needs to happen. And just like anybody, it's really helpful to have somebody in your corner, somebody reminding you how to engage in that practice, and just being there to support and encourage. Okay. So that works well when that family member is able to attend our treatment sessions and learn alongside the person who needs therapy. But there are many cases where the family members live in another state, or we're talking about maybe the medical professionals that work with someone that needs speech therapy. They need to learn too. It's really a community of people that can support someone. And in this case, with these videos, the first videos that I've come up with are specifically for people with aphasia. So aphasia, you might have heard this in the news with, there are several kind of famous figures that have aphasia now, have been recently diagnosed. So that's popping up. So aphasia is when you have trouble finding the words that you want to use in language. So there's lots of, oh, what's the word? Oh, I can't think of it. And it really interferes with communication. But aphasia can also impact how well we listen and understand language, and also reading and writing skills. So the first video series is dedicated to people with aphasia. And the idea is that it's aimed to train anyone who knows or works with someone with aphasia to support communication. So I get that a lot. I know somebody with aphasia, but I don't know how to help. And so these videos are for those folks that want to learn, but aren't able to attend treatment with the person.
Yeah. So it sounds like it would be a great thing for a lot of the in-home care provider groups that are out there, right? There are probably 500 of them in the DMV area to get all of their nurses, right, or aides trained, because I think it would be helpful even if you don't have a diagnosis of aphasia, but just, I think as we get older, and correct me if I'm wrong, because the brain science here, right?
Yeah.
That we do forget things and words, and sometimes, I joke that mine is, I've only got so much space in my brain, and sorry that has been overwritten by something more important.
Yes.
My husband goes, how could that be more important? Well, my brain decided it was more important.
It's true. Yeah.
Yeah.
You're right. Having difficulty with word finding is a normal part of aging. So there are many folks that are getting up there in years that have just general trouble with word finding without having experienced a stroke or a brain injury. And I'm really glad you brought up those, skilled nursing assistants, caregivers, because a lot of them are working with people with dementia. And it's very common that people with dementia have difficulty with word finding. For example, Bruce Willis was diagnosed with primary progressive aphasia, which is actually a form of dementia. But it affects language before other functions of the brain. So these tools really could be beneficial to many, many people in the community. And that's why I'm so appreciative that you're helping me get the word out about it.
Yeah. So tell us a little bit for folks that might have a family member who have had, some sort of diagnosis, or they think might benefit from some of your help. What are those first steps?
Sure. I mean, I think that the first steps are to become educated, seek out resources in your community. That I have actually a page on my website with a list of resources. It's www.adultspeechtherapyservices.com. But
And we'll put it in the notes.
perfect. Thank you. Yeah. So there's a resources page in there that has really community resources. Because people with aphasia need support on many different levels, whether it's getting a ride somewhere. Lots of these folks don't drive, or if it's just finding support groups in your community, because it's not just the person with aphasia that needs support, it's their family members and caregivers too. So there's lots of really knowledgeable folks in the area that support not only older population, but also anyone that has a communication disorder as well. And then if you're interested in working with a speech therapist, I think it's important to find one that is experienced working with adults. So like I said, I think there's a big difference between working with the pediatric population and working with the adult population. And I get that a lot, that there are they say, I found a bunch of speech therapists, but they all work with kids. So if you can find someone with adult neuro experience, that can be very beneficial, because there's so much to know about the adult population that's so different than kids.
Yeah, even the techniques.
Yeah. Oh, yeah. It's really different. Yes. And I mean, there are certainly speech therapists out there that have experience working with both pediatric and adult population. In my practice, I just feel that it's important to focus on adults because there's just so much to know. I want to be sort of an expert in my field and not sort of dabble in all of it. That's just how I look at it. But yeah, I really encourage folks to find the support of people that are knowledgeable about their specific need. It's just like going to a doctor. If you have a skin condition, you're going to find a dermatologist. You're probably not just going to be satisfied with your general, care provider. It's the same in the speech therapy world. Everybody has their specialty areas.
Yeah, we always preach the word of find a specialist.
Yeah.
Don't just go, your neighbor's a lawyer and yeah, they could do your will, but we've seen a lot of those that were not very good. So always find a specialist.
Exactly. Yep.
So for this kind of treatment, is this an in-person thing, or can this be done virtually to where you could see somebody in another state?
Great question. So with aphasia specifically, and with actually many of the other diagnoses that I treat in adults, we have research that supports working via telehealth over the computer. So, I offer both in-office and also telehealth experience or appointments. The tricky thing is, though, that there is a licensing issue. So right now, the rules are that a speech therapist has to be licensed in the state where the client or patient is located.
Okay.
So, for example, I can treat folks in Maryland and Virginia because that's where I'm licensed via telehealth, but technically I couldn't treat somebody who's living in California because I'm not licensed in that state. Eventually these things may change as the world sort of catches up with the, all of the technology that we have now. But yeah, that's how things stand for now. But I think it's good for people to know that speech therapy can be delivered via telehealth. So if you don't live near a speech therapist, you can still access the care that you need. And ever since COVID, Medicare is covering telehealth speech therapy services, which is huge.
Yeah.
And we hope that continues. It's always kind of up for debate again when the budget is considered in Congress. But for now, Medicare is covering speech therapy via telehealth.
Very good. Wonderful.
I'm learning a lot today.
Lots to know.
Yeah. So a couple of questions that we ask everyone is what inspired you to go into this field and to work with adults specifically?
Yeah. So where to begin? So I guess back when I was in high school, which seems like a lifetime ago. I actually, a close family friend had a stroke and she went from being this very powerful woman in the community, a leader in the community, to literally not being able to say words at all. And that had a really profound impact on me. I thought about how amazing it would be to know how to help her. I wanted to be able to help her. So when I got to college, I sort of looked into speech therapy, and they had a great course. And as soon as I started, I enjoyed every minute of it. So I feel very lucky to have found my niche, my calling kind of really early in my college career, because some folks really have trouble with that. You kind of search around forever. And so I'm so lucky to be doing exactly what I wanted to be doing when I first started on this career path. So my passion has always been adults and wanting to help people who know that they have lost something. That's what I find. That's one of the difference between adults and kids. With kids, you kind of have to trick them into doing the speech therapy, make it seem like a game. But with adults, they come to me because they are going through probably one of the most difficult times in their lives, and they are highly motivated most of the time to really get back to where they were, if at all possible. So I find it very rewarding to work with folks who are equally as motivated to improve, and we work together. We're a team. So
awesome.
Yeah.
So what's the one piece of advice that you wish more people understood when it came to speech therapy for adults?
Well, aside from the fact that it exists, that adults also need speech therapy, it's an option out there. I would say, I guess it's the message that we sort of already talked about, that progress is possible. And that's a really important message. Whether you had a stroke decades ago and you're still recovering, we know now that your brain can continue to heal. I also tend to work with some adults who have had speech therapy issues their whole life. And maybe as a kid, they had articulation problems, they have trouble saying sounds, and they still aren't happy with their speech. I have worked with adults who had problems as a child and want to kind of continue to work on it into adulthood. And we do make progress there as well. So progress is possible. Yeah.
The last one.
What is one item you can't live without in your day-to-day life?
One item? Is this, okay. Like in terms of work and working with clients in general? Oh, gosh.
First thing that comes to mind.
The first thing that came to mind, it's probably an answer you get all the time, is my cell phone. I mean, it connects me to everything and everybody. And when you have your own business, I mean, I use it for so much. So for better or worse, I think it's my cell phone. I have been trying to put it down though in the evenings. I joined a book club recently. So I'm actually reading physical books.
Yeah. Me too.
Yeah, good. Yeah, it's fun, right? It's like, all right, I don't need my phone for everything.
A bunch of the girls in the book club they listen, or they do. Yeah. At it on your phone, but I like the physical books myself.
Yeah, me too. There's something about it.
Yeah.
So Kindle's allowed me to read in the middle of the night. So
that's good.
Ooh, excellent point.
When I can't sleep, or when your brain's like churning, picking up a good nonfiction book sometimes helps that churn of all the to-dos.
Yeah, I get that.
Yeah. So, all right. Well, this has been great, Jessica. Yes. Thank you for joining us.
Absolutely.
And we will drop the link to Jessica's course and how you can contact her in the comments when this goes live. So,
great.
Yeah.
Well, thank you again for having me. It's been a pleasure.
Yeah, it's been wonderful.